Good day, learners. Welcome back to my channel. This is your mentor, Ray, spending another knowledge pack time in terms of presenting a specific concept. For this engagement of ours today, we'll talk about the use of crutches, specifically the highlights or the pointers that I'd like you to remember for the NCLEX-RN. So,
that I've gotta do, so I'm not crying.
I have a mission that I'd like to share with you guys, and I'd like to invite you to join us, specifically me, in this mission. Our goal is to provide free NCLEX-RN application and review to at least 100 nurses in the next months or so. So to help us achieve this, there's a very simple thing that I'd like you guys to do. Just watch and finish the ads in our videos, and I would really, really appreciate it if you just allow don't actually skip on the videos, finish it before engaging in our videos, such that whatever it is that the video makes will be pulled back to help nurses apply and then review for the NCLEX. Of course, the review, I could just possibly give it for free. There's no problem about that. But they would still need to raise funds for their application, which you know for a fact causes so much in terms of the nurses' savings. So at this point in time, we'd like to propel more nurses to achieve their dream of becoming an NCLEX passer. Okay? So I just hope you could join me in this mission, and I'll update you every so often related to the nurses who are becoming the recipient of this mission. So that's a very simple favor I'm asking from all of you guys. Thank you very much in advance, okay? Now, when we talk about crutch walking, what types of questions do we expect? And this is what I keep on saying, that 50% of the battle is already won if you know what to expect. So let's pay particular question like this: which instruction is appropriate to provide a patient with an injured leg who is being prepared to walk with crutches? Select all that apply. And then you have several options, okay? And this is kind of difficult to answer if you did not browse through your concepts related to crutch walking. Another type of question would be this: a nurse is teaching a client on how to walk with a 3-point gait using crutches. Arrange the following steps in order. Once again, this is challenging for the nurse who forgot to refresh himself or herself with these very, very basic concepts. But sometimes that's our tendency. We forget the basic ones. We focus on trivial things, highfalutin things. That's not the way to do NCLEX. You have to start with the most basic nursing skills, specifically the ones that you need to master as a nurse, because you need to teach it to your patient. Okay? So let's move along. So the first thing I'd like to highlight related to the use of crutches would be, we have to standardize our knowledge of the basic parts of a crutch. So you have here your crutch pad, okay, topmost portion, and then the middle part, you have your hand grips, okay, and then the lowermost part is actually your crutch tip, which is usually with a rubber thing, okay, and that's to prevent the client from slipping, okay? So what is important for you to remember about the use of crutches would be the do's as well as the don'ts, okay? And let's begin with functional concepts, okay? To ensure proper positioning for crutch walking, always remember to have the top of the crutches 1 to 2 inches below the armpits. So the crutch pad should be 1 to 2 inches below the armpits. Okay, so in essence, you have to have ample space between the armpits and the crutch pad. Okay, this is to prevent injury into the nerves in that area. And then keep the hand grips at the level of the top of the hip line. Okay, or if you will ask the client to freely hang the arms, the hand grips should be at least at the level of the wrist of the patient. Okay, and then the elbows should be kept slightly bent around 15 to 30 degrees. Some literatures would say 15 degrees, some literatures would say 30 degrees. So let's take a range, 15 to 30 degrees, okay? And keep the body weight on the palm of the hand, never on the armpits, or never put on the weight on the crutch pad. It has to be on the palm of the hands as you hold on to the hand grips. Now, pay particular attention that the tip of the crutches should be at least, okay, 2 inches to the side and 6 inches to the front of the feet. Okay, so that should be the distance. Okay, so 2 and 6. So that's a total of 8 inches. Okay, okay, so let's move on. Now, there are several types of crutch walking gaits. So we begin with the 2-point crutch walking gait. This is actually a faster version of another crutch walking gait, which is the 4-point crutch walking gait, which we're going to discuss after this. So its main advantage is that this is a faster version in terms of the patient's movement, okay, of the 4-point crutch walking gait. So in a 2-point crutch walking gait, there are only 2 main instructions that you have to provide the patient. You have to instruct the client to move with the left foot and the right crutch together. So that would mean the left foot and the opposite crutch. So the left foot and the right crutch together, followed by the right foot and the left crutch together. So it's like a foot and then a crutch together, followed by the opposite foot and the opposite crutch together. So that's just 1, 2, 1, 2. Okay, so let's move on now to another type of crutch walking gait. This is actually the 4-point crutch walking gait, in which the movement, okay, would be a little slower than the 2-point crutch walking gait. This is used when partial weight bearing is allowed in both feet, but the main advantage of the 4-point crutch walking gait over the 2-point crutch walking gait is that it provides more stability or better support for the patient because the movement is kind of slower, okay? So the movement begins by advancing the right crutch, followed by the left foot, and then the left crutch, followed by the right foot. So it's like crutch, leg, okay? So crutch, leg, crutch, leg. Okay, so that's actually the 4-point gait. And then we shall be proceeding with the 3-point crutch walking gait. Now take note, pay particular attention to the fact that in a 3-point crutch walking gait, okay, this is usually indicated when a patient has injured a leg, okay? The advantage of this type of gait is that it can be used even in a walker. Okay, so how do we instruct the client to move now in a 3-point crutch walking gait? So we ask the patient to advance the crutches and the bad leg together. So crutch, the crutches, and the bad leg. And then we shift the weight on the palm of the hand by pushing on the hand grips and then advance the good leg. So once again, crutches, the bad leg, shift the weight on the palm of the hand, and then the good leg. So always remember that the bad leg is supposed to be supported by the crutches. That's why you move it together with the crutches, okay? So let's move on. Then we have the swing to crutch walking gait, okay? In the swing to crutch walking gait, once again, weight bearing is allowed in both feet. So therefore, all you have to do is to instruct the client to advance both crutches forward and then swing both feet to the level of the crutches. So both crutches, then swing both feet to the level of the crutches. Now, how is that different from the swing through crutch walking gait? Once again, swing through crutch walking gait is indicated when weight bearing is allowed in both legs. So just like the swing to gait, you just have to advance both crutches forward and then swing both feet this time past the level of the crutches. This is considered as the most advanced gait, okay? So the difference between the swing to and the swing through crutch walking gaits would be in the swing to crutch walking gait, you just move both crutches forward, then swing both feet to the level of the crutches. And in the swing through crutch walking gait, you instruct the client to advance both crutches forward and then swing both feet past the level of the crutches. Okay, now what about when a patient would want to move upstairs? So just instruct the client to move the good leg up first and then move the crutches with the bad leg. Remember, we always need to support the bad leg with the crutches. So good leg up first, followed by the crutches with the bad leg. Now, What about to move downstairs? You do the reverse. So instruct the patient to move the crutches with the bad leg down the step and then move the good leg down next, okay? So let's simplify this. Always remember to move upstairs, good leg to heaven, and then to move downstairs, bad leg to hell. So that simplifies the thing. So if you are instructing the patient to move up the stairs, then instruct the client to move up with the good leg first, good to heaven. And when the patient is moving downstairs, you just have to instruct the client to move the bad leg first. So good to heaven, bad to hell, okay? So let's go back to the types of questions that we need to answer related to this concept. And this time we are now armed with the concepts that we need to remember in a functional way, okay? So let's proceed. It's appropriate to provide a patient with an injured leg who is being prepared to walk with crutches. Never support yourself on your armpits, yes, okay, that is needed so as not to damage the nerves in that area, okay. Sometimes they would say brachial nerve injury or paralysis could result from that. Keep the crutches close to your body, yes, to maintain the balance, but take note, the lowermost part of the crutches should be at least 2 inches lateral and 6 inches forward, okay, from the feet, okay. So yeah. While going downstairs, place the crutches on the next step below, then step down with the good leg first. This is going downstairs. What did we say? Good to heaven, bad to hell. So when you're going down, should be the bad leg first. So this is an X. And flex your elbows about 30 degrees as you hold onto the hand grips of the crutches. That's excellent. We're getting that perfectly. And this time we're going to do our drag and drop type of question. So a nurse is teaching a client on how to walk with a 3-point gait using crutches. Arrange the following steps in order. Okay, so this is a 3-point gait. What do we instruct the client to do? Move the crutches together with the bad leg. So crutches, okay, and then the affected or the bad leg. And then we shift the weight on the palm of the hand as we hold onto the hand grips, okay? And then we move the good leg or the unaffected leg. And that's perfect. Okay. Now, what are the possible NCLEX-RN issues that could actually pop out aside from those that we have already tackled in terms of the questions that we are expecting for this concept? So, here's a question. How can a patient using crutches sit down? Okay, let's answer that with a functional concept. To sit down, move towards the chair. When the chair touches the back of the good leg, remove the crutches from under the arms and hold both crutches in one hand. And then stretch the bad leg out in front and then slowly sit down, okay? Now, what about if the patient would want to stand up? Hold onto the hand grips of both crutches with one hand and use the other hand to hold onto the side of the chair and then stretch the bad leg out in front. Push to stand up with the good leg while one hand is holding onto the chair and the other hand holding onto the hand grips. And then place the crutches under each of the armpits and stand straight. Okay, let's move on. Now, what about if you are asked this question: how is safety ensured in a patient who is using crutches at home? So let's answer that with a functional concept again. To ensure safety for crutch walking, instruct the client to be careful of throw rugs. Okay, this could actually cause them to fall. Then wear low-heeled sneakers. Okay, if falling, instruct the client not to fall with a crutch. So instruct the client to throw the crutches out to the sides and use the arms to break the fall. This is actually to prevent being injured with the crutches. Then when attending school, we ask the teacher to allow the student with crutches to leave ahead of the class so they avoid the crowd, especially if they have to navigate through the stairs. And then we need to actually instruct the student to keep the bad leg up on stool when they are sitting for a class. And the most important thing, do not lean on the underarm pieces, okay? Now, if you love this video, please don't forget to subscribe and hit the like and bell buttons. Please, once again, may I ask you to finish watching the ads in this video so that we could actually help out our fellow nurses turn their dream of passing the NCLEX-RN by giving them the opportunity to take the test. So I'm raising funds and I'm also contributing funds from my personal funds to help out at least 100 nurses for a start, okay? So this is Mentor Ray once again saying, a functional concept a day keeps your NCLEX-RN fears away. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. And if you want me to cover some concepts in the future, please do send me a message, a note, or a criticism, or whatever you may want to send me. For as long as we're communicating, I would love that, to my email, mentor.raygapuz@gmail.com. Okay? Disclaimer, this instructional tool is created to enable students to develop their test-taking skills. The question or questions in answer or answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly implied or otherwise, that the rationale discussed is officially endorsed by NCSBN.